The septum is the midline in the nasal cavity that divides the left and the right nasal cavity. The septum is a combination of different anatomical structures. It consists of nasal skin, which is called the nasal mucosa, on the left and on the right side, and in the middle we've got cartilage and a bit of bone, and together this is what we call the septum. We know that overall about 80% of the population is having some kind of septal deviation, and also from studies we know that about 30% of the overall population is complaining of some forms of nasal breathing problems. If you have excluded all the problems including rhinitis, allergies or rhinosinusitis, and if you can see in a clinical examination that the septum is the main cause for the breathing problems, which is about 1 to 2 out of 4 patients who suffer from breathing problems, the treatment option is to straighten the septum, and this is what we call a septoplasty. I want to divide this answer into 2 parts. You can either do a septoplasty purely for functional reasons. When we talk about functional reasons, the patients with a septal deviation complain mainly of a unilateral obstruction of the nasal airway, which occurs mainly in the young adult life or after a trauma. But we also know that patients profit from a septoplasty when they snore quite heavily, and especially patients with a body mass index of less than 28 profit from this procedure. And we also perform septoplasty for functional reasons if patients have recurrent nosebleeds and a straightening of the septum is reducing these nosebleeds. We also perform septoplasty for aesthetic reason combined with a septorhinoplasty or a rhinoplasty. There's a very famous saying from a very famous nasal surgeon: where the septum goes, so goes the nose. So it's of utmost importance to straighten the septum within a rhinoplasty to get the best functional and aesthetic outcome after a septorhinoplasty and a combined aesthetic procedure. If you come to see me as a patient, in regards to a septoplasty, we will first assess your normal medical history. We'll have to go through all possible reasons for a breathing problem, including rhinosinusitis, allergies, rhinitis. We'll have to assess if you have further symptoms, including postnasal dripping, nasal discharge, how the sense of smell is, if you have any allergies or asthma. After assessing this, we'll go and examine the nose in detail. We'll start with assessing the external nose. Are there any deformities, for example, post-trauma? Have you ever had any surgery that resulted in a deviation of the whole nose? Are there any deformities, for example, like cleft lip and palate deformities? And then moving from the external examination, we go to the internal examination, and we first start with an anterior rhinoscopy. This means we'll pop a little instrument into the nostril, into the opening of your nose to assess the front part of your nasal cavity. And after the anterior, we perform the posterior rhinoscopy, and this is done with a little camera. This is popped into your nasal cavity to assess if there are any polyps or other anatomical structures that could contribute to a nasal breathing problem. If the septoplasty is performed purely for functional reason, it is a very short and straightforward procedure. The procedure is performed normally in general anesthetic, so the patient is fully asleep. Before we start with the surgery, I use in my practice a lot of local anesthetic and also local infiltrative blocks to reduce the post-operative pain of the patients. I then, with a tiny incision inside the nasal cavity, start to lift off the skin from the cartilage that I can assess the cartilage properly, and after that I'll reduce step by step the deviated parts of the cartilage and the bone until the leftover cartilage is straight in the midline. When we perform this surgery, we have 2 main goals. One goal is we want to improve the breathing. The second goal is we don't want to change the shape of the nose. And the closure of this little incision and also the stabilization inside the nose is purely done with resorbable sutures. I'm not placing any packets or any silicone splints inside the nose, so the breathing after the surgery is directly very well. The recovery after a septoplasty, as it's done under general anesthetic, especially in the first 24 hours post-surgery, you will feel a bit tired because of the general anesthetic. Normally, the pain after a septoplasty is really minimal. You will feel a bit of pressure, a bit of tightness in the nose, especially due to the stitches that were used during the procedure, but this can be managed easily with paracetamol or with ibuprofen. Whenever you operate, you get swelling, so you also will get a bit of swelling inside the nasal cavity, and this swelling can lead to an impairment of the ability to breathe properly. But I will provide you, especially during the first 72 hours, with dicongestive nasal spray to reduce the swelling, a saline douche to rinse out the nose, and antibiotic ointment to create a very good wound healing environment, as I'm not using packings or any kind of splints during a septoplasty. You don't have to go through the procedure of removing these packings after a nasal surgery. Managing patient expectations starts with the first consultation in the clinic. I have to make sure that the septum is the main contributor to the nasal breathing problems. I have to exclude anything else that can contribute to breathing problems, including problems with the inferior turbinates, for example, swelling due to allergies. I have to exclude chronic rhinosinusitis or polyps that can contribute to nasal breathing problems. We have to make sure that you have a free postnasal space and there are, for example, no adenoids. We also have to assess the nasal valve properly, that you have no nasal valve collapse or a narrow nasal valve that can contribute to breathing problems. And if we've excluded everything and the septal deviation is the main contributor to your nasal breathing problems, I'm very confident and I almost can guarantee you that with a septoplasty, with straightening the septum and reopening your nasal breathing passages on both sides, I can improve the breathing and improve the overall quality of life.